provided. For today's agenda, we will, I think we'll review and approve February and March meeting minutes because so far we have 4 PMAC members. I think we need 5 or 6. So what we might do is kind of an informal approval, and if I have to take it back to the full committee next month or the month after, that is fine. So we will spend some time reviewing the February and March meeting minutes. We'll then share a little bit of information about this week's board meeting, just some very high-level information. And then I'm going to turn it over to our newest PMAC member, Emily Wong, who's going to share some information on some member experiences and stories as part of our ongoing health equity and member work. After that, we are going to have our EAP partners over at Canopy present information on what they've observed about our members during the pandemic, including sharing some info on all the services that are available and what the utilization looks like. Note to the committee that this will largely be the same presentation as was given to the Worksite Wellness Coordinating Council earlier this month, but since only a couple of PMAC members were able to attend that meeting, and because the presentation was really great, had a lot of great information, we thought it would make sense to bring it back to PMAC. So for those of you on both PMAC and the council who were able to attend Canopy's presentation earlier this month, we placed that last on the agenda, so that way if you had needed some extra time, you could feel free to adjourn and leave a little early, or you can continue sticking around and listening to the conversation. So let me stop there and see, do we have any other PMAC members who have joined besides Cindy, Emily, Veronica, or Angela?
Yep, Lisa Hayes just joined.
Okay, perfect. Thanks, Lisa. All right, so we're on the at the point of the agenda where we're going to review the February and March meeting minutes. Those are also part of your meeting packet that Rebecca sent out. So we will spend a few minutes reviewing both sets of minutes, and then I will open it up for one of the members of the PMAC committee to motion to approve or to edit and approve. So with that said, I will keep myself quiet and go on mute for a few minutes. And if you do have any questions or concerns about the minutes, please speak up. Don't feel like you need to raise your hand.
You're on mute.
Thank you. Just a note, looking through these minutes, it looks like most of the things we captioned are action items that we're moving forward already in terms of this meeting and getting ready for next month. So just a note. Okay, are there any committee members who would like to offer a motion to approve or a motion to make any corrections and approve both sets of meeting minutes?
This is Angela. I'll move to approve both sets as documented.
All right. Looks like we have a hand raised. Emily?
Yes, sorry. I was trying to close a window and I fell off of the
You accidentally raised your hand then?
But
Okay.
well, no, actually, so for the March minutes,
Mhm.
I just had a couple like minor
Yep.
like clarifications. So for number 2, Kaiser Permanente, where it says Emily suggested that one day we include data on the 9 federally recognized tribes in Oregon. I just wanted to maybe add one more point before that, because the reason I brought that up was Kaiser was showing their racial ethnic data, and then they had an other category, and then tribes were in the other category. So just wanted to like call out like a future discussion about having kind of tribal data, native data be a standalone category, not with the other category. And then, and yes, we can keep that about having data about the 9 federally recognized tribes, but also the broader number of tribes and urban Indian populations. And then the 9 federally recognized tribes comment is because of the special government to government relationship that the state has with the 9 tribes. And that's through Senate Bill 770 that passed in 2001.
So it's due to the special relationship the tribes have with the state government.
Yep. Mm-hmm. Yeah.
All right, we can make that.
Yeah, and it'd be great to educate all the carriers and PMAC and PEB if they don't already know about that relationship.
Absolutely. Okay, so I think Lisa, did you offer the original motion, Lisa?
No, but I
Or
was
was it
at
Angela?
the March 17th meeting, and I am not listed on here as a committee
Oh.
member that was attending.
Okay. We will add you. Okay, any other corrections or updates? Okay, I think we want then an updated motion to approve both sets of minutes with the stated corrections for March by Emily and Lisa. Do we have a motion to approve with those corrections?
This is Cindy. I second that motion.
Okay, Cindy. We'll consider that the first motion since I'm adding the corrections. Do we have a second for that motion?
This is Angela. I'll second that.
Okay, thank you. Sorry for any confusion. Okay, I'll do a quick roll call. Cindy,
Yes.
Emily,
Yes.
Veronica,
Yes, I'm here.
Angela,
Yes.
and Lisa.
Yes.
Okay, and have I missed any committee members who have joined since we started the meeting minute review?
Yeah, this is Steve Sander. But I wasn't actually, I had conflicts on those days, so I'm okay not voting necessarily for the meeting minutes. Thanks.
Yep, absolutely. Perfect. Okay. Let me make sure I record you down though, Steve. Okay. So next on the agenda, now that we've gone through the meeting minutes, we have, as I mentioned, a quick high-level board update. So the board covered a number of items earlier this week on Tuesday. We're not going to share any details. Folks can find the meeting materials on our website. And for this month, and maybe something you guys are interested in, I'll jump in a second, but I will turn it over to Rebecca to provide some highlights from that board meeting.
Hi, good afternoon, everybody. This is Rebecca. So like Brian said, they covered about four items at the PEB board meeting that was on April 19th, this Tuesday. The first item was the PEB administrative fee that was up for an action item. This was approved by the board. They also spoke on health equity. There was a committee update by Michael Garrett from Mercer. They spoke about the round 3 renewals. Most of those, I believe, were approved. This was round 3, as I just mentioned. And then, if I'm saying this correctly, Brian, you can correct me, but a PREP coverage audit update findings was discussed. And all of these, I have the material on. This is, of course, public. So if anyone's interested in any details on any of these items, I can forward the meeting pack to any of you. If you want to see the live stream recording, I can show you where that is on our PEB website. So please just send me an email if you want further information on any of those items.
Thank you, Rebecca. And just to note for the committee, the reference to the round 3 renewals, that's usually the final round of renewals between our board and our carriers. So long story short, our board made, I believe, most of the benefit and renewal decisions for 2023. There still may be a few outstanding financial kind of cleanup decisions that may be needed. So if you're interested in seeing some of the benefit changes, I would look at the this week's meeting materials at the Mercer slide deck, which will walk you through the proposed changes that the board consider and then accepted. So any questions before we move on to the next agenda item? Okay. So moving on, next on the agenda item, we have a discussion where we'll share some member experiences and stories. If you recall, we identified a number of steps for our work that should take place, after Teresa and I had presented to the board in the fall. And these steps included, among other things, gathering more information about what our members have experienced both pre and post pandemic, and getting a better sense of what struggles and barriers are our members experience to, getting the care they need, the services they need that PEB offers. The rest of today's meeting will be devoted to that information. So we're going to focus in on the member stories, the member experience through some information that Emily will share, and then we will also have our EAP vendor, Canopy, present some really value information. So Emily, I think, I have shared a member story with the committee in the past, and I think I'll probably want to just recap it before I hand it off to you, just to give kind of folks a flavor of what we'll get into. But I did want to mention up front, before Emily jumps in, is that a lot of these stories we're going to hear about and the information we asked for were really holistic stories. So we're not just asking our members what's up with our, benefits or services that PEB directly provides. We're really asking them what's going on with our members in general that can create, hardships or barriers to getting the services and care that we provide. So we're going to hear a lot of information that people may not feel are in PEB's purview, and there may be, things about HR policies or other things that PEB can't necessarily speak to. But we felt it's still important to understand what members are going through in order to do our work and to do it well. And so just know, as we hear these stories, there are going to be some things that we will be able to find things that we can do about. There'll be other parts of the stories that maybe we just have to partner with other parts of state government, or share information with others to help, figure out if those are things that can be addressed by, by the state or by PEB. So in terms of the member story that I previously shared to PMAC, and I'll just button it up fairly shortly, it was a member who, before the pandemic had started, was trying to get some autism treatment approved for his son. The member struggled to get the appropriate, approval. Apparently, it required a referral in this circumstance, and it took something like 8 months to finally get that referral approved, so that way they could get his son in to start getting this autism specific treatment. Unfortunately, by the time the member got the referral approved and started taking his son into the provider, the pandemic had hit. And this member had observed that this particular clinic or provider didn't consistently enforce the mask requirements. And long story short, the member didn't feel necessarily safe continuing to bring their son and family into this environment. But when they reached out to the provider about this, they were told that those same services that their son required weren't available remotely or virtually. And so it put the member in what must have felt like a lose-lose situation. Do I risk the safety of my, family with this COVID thing going on, or do I, delay my son's, treatment? And again, in this case, if the reason for not providing, remote treatment is due to clinical guidelines, it may not be something that PEB, has in its power to control, but it's still important to understand the story and what sort of barriers that members are experiencing, if that makes sense. So with that, I think I would like to hand it off to Emily Wong, who's also our newest PMAC member. Emily, I believe, has a presentation that she will share. And so Emily, I will hand it off to you.
Yes, thank you, Brian. I am going to share my screen. Let's see. And then Brian, and others, if you can help me monitor the chat.
Yep.
Because yeah, once I start showing this, I won't be able to see anybody's messages or even see your faces or anything.
I
So-
can do that. And also
Okay.
we're early on the agenda, so I'm not going to worry about time constraints until we start hitting up against that planned time. And even then, since we have a pretty full agenda, we'll probably keep going as long as there's questions and kind of play it by ear from there. So welcome, Emily.
Okay. Thank you, Brian. And I'm actually going to share snippets of a number of employee stories and experiences in accessing the PEB benefits and healthcare. And this would be mostly from Oregon Health Authority employees, but also I'm actually going to end with a story from Oregon Department of Human Services employee that's in the Roseburg area of our state, a more rural area of our state. And just a heads up that I don't know if everyone knows here, but in my membership with PMAC, I'm representing SEIU OHA as their first contract specialist or labor relations liaison. But another role that I play is as co-chair of the Oregon Health Authority People of Color Employee Resource Group. And then my other co-chair, Rebecca Knight Alvarez, she's also going to be joining us today. She's actually wrapping up another meeting right now, but she'll be popping in soon to chime in and then share a couple stories from her perspectives. So as Brian said, I'm one of the newest members of PMAC, and he had shared in my onboarding that PMAC was interested in getting some answers about the 3 questions that are here on this PowerPoint slide. What challenges, if any, have state employees and their family members experienced trying to access PEB benefits and healthcare pre-pandemic? And then how have these challenges and experiences changed during the pandemic? And then how can PEB better address challenges, including access for you and your or for employees and their family? And so it just happened that timing was good because we were just about to launch Worksite wellness surveys for both our OHA People of Color Employee Resource Group and also the OHA 5 Oak building community. And so what I did was I went ahead and integrated these questions into those two survey instruments. So I can actually share some of their responses to these questions. And then for the POC ERG, the People of Color Employee Resource Group, I'm actually going to expand upon some of that information that we received in the survey, especially given the interest of this group and PEB in health equity. And then sprinkled throughout, also going to share some findings from our conversations with the leadership of OHA, POC, ERG. And then Rebecca, the co-chair, she's also a member of the COVID Recovery and Response Unit at OHA in the Public Health Division, and she's a member of their wellness team. So she had some additional insights to share with that role. So beginning with the People of Color Employee Resource Group survey results, there were about 22 folks that participated and answered the questions. And I just wanted to give you a little background information, demographic information about those participants. So they're from a variety of racial, ethnic, cultural identities, including mixed racial ethnic identity. So the biggest groups were Hispanic, Latino, Latina, Latinx, and also Asian. So about 7 there, and then about 5, 6, 7, 8 like Asian and biracial or multiracial, and then Black African American 3, biracial 1 with Black African American, American Indian, Alaska Native 1, and then also Native and white, and another that's other biracial. And then I just wanted to highlight that even though our employees that took the survey have these racial, ethnic, cultural identities, their family members may have different racial, ethnic, cultural identities, and then also may prescribe to different health and healing practices and or religious or spiritual beliefs than our employees, even though they're in the same family. As some folks probably realize, Native, Pacific Islander, communities of color, they often have 3-generation or multi-generational families, including myself as a 2nd-generation Asian American. I live in a 3-generational household. So oftentimes there'll be differences between the generations in terms of how they approach health and healing. Like, 20-year-olds versus the 70-year-olds, for example. And then in terms of gender, this was majority women that answered the survey, and I think that's pretty true for most surveys at OHA. And we also had 1 transgender, non-binary participant. And then we asked about generational status of our members in the U.S. This is kind of a newer question for us, and it's kind of our acknowledgement that 1st-generation immigrants to the U.S. may have very different needs, healthcare needs, than those who have been in the States for over 3 generations. And so from our survey here, we actually had the majority, our 2nd generation, like myself, and then the 2nd largest group was 3rd or more generation, and I would include our tribal members who are the original people of this country. And then there were 5 who were 1st generation in the US, and then other. And then in terms of OHA divisions, we actually have 8 OHA divisions, and the participants come from 6 of the 8 OHA divisions, but with the majority coming from Public Health Division. And then this was interesting too, kind of how long have people been working at OHA? So it's from as little as 2 months to over 10 years. And then before we get to the answers to those 3 PMAC questions, also just wanted to give a little more context about why we conducted this survey. We're going through a public health emergency with COVID. This was year 2 of that public health emergency, where we were hearing that a lot of OHA staff were stretched, stressed, and And so we wanted to check in and see how their wellness was doing and if there was anything that that they needed urgently that we could try to help facilitate in terms of support. And so for sure, the results do verify that our staff of color, who often are disproportionately impacted, I think COVID has made that more visible than ever before, are definitely stressed and fatigued and experiencing moral injury. I don't know how familiar people are with that term moral injury, but this is how we define it in the survey. Moral injury is the psychological, behavioral, social, and/or spiritual distress experienced by people who are performing or exposed to actions that contradict their moral values in their job. And so back to these results, in the last 12 months, 59% felt stressed often or always during the workday. Over 60% agree or strongly agree they've considered leaving the job due to stress. And then look at this, 95.4% or 21 are experiencing burnout and fatigue. And moral injury, it's 54.5%. And then discrimination, especially since communities of color, tribal, Native, Indigenous staff are still the minority in our predominantly white workforce in state government in Oregon. So discrimination is still happening. Over 50% are experiencing discrimination due to race, gender, over 36%. There's 27% that say they are not experiencing discrimination, so that's good. Some are experiencing discrimination due to age, and that's over 18%. Some don't know, and then this actually, some of my research colleagues wonder how much this response has to do with the intersectionality of some of these choices that we provided in terms of discrimination. So perhaps some of our members are experiencing discrimination due to both race and gender, or both race and age, or both race and sexual orientation, for example. And then one of our members is experiencing discrimination due to lack of credentials, educational credentials. We asked about any parent, guardian, or caregiver support needs and what would be helpful at this time. And I should say that the time that we surveyed was around February-ish through April. And so this was the #1 response. People wanted to reduce their work hours to 32 hours a week during this global pandemic so that they could do a better job parenting their children. And as you recall, people were having to pivot from in-person to online school and having to deal with technology needs, and some have more than one child at more than one school and, may not have multiple computers at home for all those
And
kids.
Emily, I was going to say this will also be supported and bear out with Canopy's presentation, as those of us who saw it last month or earlier this month can attest. So I believe in their presentation, we'll see caregiver support or elder support as one of the categories of need.
Great. Yes, I recall that. I would love to dive deeper into that. And so these are some other areas of need. Definitely people said they need additional parent guardian support, including help with getting manager support of their children that are in the home as they're working virtually. Some managers are not very don't want that happening, don't want any children around. And so families also highlighted the need for behavioral health services for family members, additional caregiver support, and needing some support finding a CNA, an LPN, an RN, or other healthcare provider to help with their family. This was another question that we asked on the survey because our members had been talking about this a lot. Have you been asked to engage in invisible labor? The way that we're defining it, there's actually a little longer definition, but for the most part, the gist of how we're defining it is unpaid work that goes unnoticed, unacknowledged, and thus unregulated, that is not included in your position description and can lead to an uneven and unfair distribution of the workload among team members. And so over 55 or 50% said yes, that they have been asked to engage in invisible labor. Happily, 41% have not. And then there's one for other. And
Do you
then
have an
these are just,
example of, oh, right there. I was going to say an example of what that could look like, but there it is.
yes, there's many examples. Here are just a few. This person says, at times I'm asked to provide a tribal perspective to equity work on top of my other duties as assigned. White staff are not given as many roles and responsibilities as I am. Work is not given fairly, especially if you understand inequities. Another person says, assisting with Spanish translations and editing documents in Spanish to be culturally appropriate. Sometimes several of us have to drop everything to assist simply because we get the bilingual differential. I'm not even sure what the bilingual differential requires of us, but it seems those of us who are Spanish bilingual work longer hours and have more projects going on. This is concerning because we are short-staffed. OHA and DHS publications and creative design has no team. Oh, I'm sorry. I think this might be specific to OHA. Well, this is their words. Has no team or funding to assist with culturally or linguistically appropriate documents. It's all contracted out, and there are significant delays. OHA needs in-house internal staff of their own. Right now, they're leveraging current staff hired for other jobs, and this reduces opportunities for promotions. And instead, we become the behind-the-scenes people who go unnoticed and do the heavy lifting. We feel a sense of moral obligation to get this work done, or no one will, and thus our own communities will suffer and die. And then here's another one about people experiencing indirect and direct asks. I know I've also heard like sometimes managers or people with position authority will make asks of staff, frontline staff, and they really don't know how to say no. And a lot of times it is like well-intentions of wanting to understand a particular culture better, but really that should not be the job of that staff person, you know, which is typically outside, at least within these comments and other meetings that we've had, outside of their position description. This person actually, and we hear this a lot because a lot of staff and leadership, managers, and here a deputy director are on leave. And so this person, it says, I have consistently worked above my grade level in a deputy director role, both as coverage when my director was out for 3 weeks during the surge crisis, as well as advising strategy development. I've been overlooked for an official deputy role, which I have been told will not be opened up. I continue to rise to the needs. And then just here, just generally supporting colleagues about their challenges and being in this environment. And again, this is specific to the people of color staff within OHA. So getting to the 3 PMAC questions. So we did ask them pre-pandemic, had you experienced any access challenges with the PEB benefits? And so this person says, we don't believe in pain medication, so instead we use proven holistic care like acupuncture. Many acupuncturists don't want to deal with insurance, thus I have to pay cash if I want to see a certain provider and then ask my insurance to reimburse me. I have to find the money to pay up front, sometimes $150 per visit. It can cost up to $600 a month for a family member. Behavioral health providers are starting to do the same. Also, another challenge is finding culturally appropriate services, whether mental health or medical. I'm assuming that will also be true for dental or oral. Another member said it's been challenging to access mental health providers who are culturally competent in at least 2 cultures, reflective of this person's family's diversity, and are also trans-friendly. This other person says, I could not get my medical provider to sign off on reducing a copay by $5 for acupuncture or chiropractic visits due to a back injury. Doesn't feel fair when I'm contributing to insurance costs and not accessing other services much. And then the second PMAC question, during the pandemic, have you experienced any challenges accessing your benefits? So somebody experienced challenge getting a booster shot, basic medical care, and dental care. And again, and I actually want to acknowledge it probably depends on which part of the state you live in, and then also which carrier you go with, which I think this group understands well, but I just wanted to call that out. And another person says the increase in providers not wanting to deal with insurance companies and the forms and the red tape has been a barrier. And this person believes it's due to inflation and assisting members with food, housing, etc. It's harder to find the cash to pay out of pocket for providers who require cash only. This person says it continues to be a challenge accessing mental health providers who are culturally competent, especially for more than one culture, and also trans-friendly. This person says, we're no longer able to continue Weight Watchers at work when the pandemic began. And also at the Portland State Office building, they were unable to access the Wellness Center when the pandemic began. And then this last person here says some challenges are even worse now because I have not been in person for any of these visits since 2019, but still paying for them insurance-wise, ? During the pandemic, I could not access mental health services because I didn't have a qualifying event that would make me eligible. It wasn't enough to feel anxious due to the extreme amount of pressure and work as staff of color working the pandemic in a predominantly white agency. And now to the third question, the third PMAC question, what ideas do you have to address some of these access challenges? So some of the members said, please provide more training on how to access the services that we have. Transportation is really important for those who live in rural areas and also struggle with disability. And I would add multiple disabilities too. Not just one person in the family with a disability, but maybe more than one person in the family with a disability. And this person says it is just not available. This person says that they're new to OHA, so having not been at OHA pre-pandemic, but their idea is that PEB could do better to warmly hand off healthcare representatives, guide employees through the process of filling out benefit paperwork besides just one webinar, and then scheduling time to check in with employees to ensure they've completed the PEB paperwork. Another person says outreach to providers, make it easier to contract, pay better prices, get feedback from specialty providers as to why they won't work with PEB. This person is very unhappy, it seems, and is asking to give my 3% back.
Which I'd say we shouldn't ask the questions if we don't want to hear the answers. So honestly, That it's fine. Honestly, if members are upset about certain things, we need to hear it. So I think having those sorts of comments in there, is kind of what we asked for.
Yes, thanks, Brian. Yeah, good point. And then this next person talks about linguistically appropriate resources and increasing the access to out of network providers, contracting with providers that can offer the services in Oregon, but that might reside in other states. So that's another idea. Another idea within provider directories include which cultural groups providers have experience serving, and perhaps the number of patients or the number of years that provider has had experience serving that particular cultural group or groups. Also include if the providers are trans-friendly and receive cultural competency training that meets OHA approval criteria for cultural competent trainings. Here's a question. Will Weight Watchers at Work and the Wellness Center at Portland State Office Building be able to start up again once offices reopen? Will PEB be working with insurance to give back to clients access to funds that weren't able to be spent or used because of the pandemic? And then another question here, why is massage not a part of everyone's medical plans? It is such a basic need. And then here is a variety of responses that fell under the other category.
And then Teresa, sorry, Emily, Teresa has her hand raised.
Oh, okay. Yeah, we can stop.
Oh, I'm sorry. I was just typing it into the chat. The PSOB Wellness Center will open up when the building opens up May 1st.
Oh, great. Oh,
Yeah.
they'll be happy to hear that. Okay. Awesome. So here it says Black, Tribal Community, POC, and Indigenous Affinity Learning Space and Support is one idea to help address some of the challenges these staff are facing, especially under equity and anti-racism, to mitigate microaggressions and harm, which we know our members experience some of them on a daily basis. Another idea to address the challenges, cross-sector approach, bring down the silos. And that this is related to OHA leadership, ODHS, Oregon Employment Office, Housing and Community Services, listening sessions. They need to hear how communities of color are being impacted and how this impacts our work and our families. Another idea to address the challenges, public health division. This is specific to public health division. And remember, those are the folks that are, leading our COVID response. So PhD, paying for outside trainings of my choice, paying for my therapy appointments, providing trainings for white staff around how to be better allies. This person is not happy with management, so says clean out management. Another person says changes in policies and in practice that recognize and support employees to work less than full time. And so you recall the 32 hours a week was one of the top vote getters in this survey. And so just recognizing that our staff are valuable contributors to the work. And yeah, if there are times when they don't need to work full time, that would be helpful. Even if in policy there can be part-time work offered, this person doesn't see how it's facilitated in practice. And if jobs are always posted as full-time, how are employees supposed to advocate for part-time or job share positions? Can this be facilitated more easily in the hiring process by stating that almost any job can be a part-time or job share position? So yeah, we have heard from our members that they think that we only have full-time positions at OHA. This other person says time is one way to address the challenges. I think a lot of us can empathize with that. And then for the agency to take some accountability and implement practices that honor work-life balance, especially in remote learning working environments. This person would appreciate if the agency offered different work schedules that actually accommodated people's lives, not just an 8 to 4:30 standard work shift. And then lastly, tips for managing heavy workloads, multiple projects, and high volume email at breakneck speed. And then speaking to our co-chairs, here are some additional ideas. And so these are through conversation following the survey. Here's an idea of changing the policy to allow for X hours of physical activity during work time. So, you know, trying to be healthy while you're at work, physically healthy. Another one, ensure childcare support is available as members access their gyms. So it's great to have access to gyms, but a lot of our staff of color have children, and so it would be important for the gym to also have some childcare support or a way for childcare support to be provided when employees access their gyms. Support for tribal and staff of color who are frequently exposed to microaggressions, which cause emotional harm, inclusive of the current anti-racism training that's happening now. This is engaged to change. That's a typo. Whoops. And then here's another idea of a culture change needed for the state agency contracted training opportunities. So recruitment of racial, ethnic, culturally, gender diverse contractors, a need to develop standard best practice to establish safe processing or reflection or affinity spaces within the trainings, which support the staff who share in these marginalized identities. Another aspect of this, increasing understanding and responsiveness to institutional racism, cultural and socioeconomic differences, which will decrease risk or likelihood of traumatizing or re-traumatizing or re-triggering experiences of our staff of color. And then this last one, explore fun and healthy ways for state agency staff and their families to connect with one another, build off existing local community programming. For example, could add culturally specific activities at the beginning or end of the programming, like Zumba or
Emily,
salsa dancing.
I would like to brag for the PMAC for the committee, because as part of their kind of overarching recommendation to PEB for the future HEM program, one of the future themes or paths that PMAC wanted to see built into that program would be around family and cultural support and those sorts of things. And so this is something that the committee's already thought about.
Awesome.
You know, and granted, you know, this vision of a future HEM program, as I've mentioned before, is, you know, years away. It takes a long time to stand it up, but it feels good to know that already those sorts of ideas are connecting.
Yeah, good alignment or synergy. Yeah, like there's this even movies in the park that we're doing already. Why not add like a culturally specific activity like Zumba, salsa dancing, Qigong, a lacrosse workshop to that. So that's awesome, Brian. And then, okay, so that was the People of Color Employee Resource Group. So maybe I'll just pause here. It's so hard to like talk and not be able to see people and not to be able to see the chat. So those were the results of the People of Color Employee Resource Group. The 22 participants that participated in the survey. As you probably can guess, people don't have a lot of time to do voluntary surveys right now, especially if they've got full workloads. But it is a pretty representative sample of the diversity and stories that Rebecca, myself, and other leadership have heard. Oh, and Rebecca's here.
Yeah, and Emily, correct me if I'm wrong, but I mean, again, if we were just to ask all of our ERGs to help design how we do anything, we're getting into that invisible labor concept that we talked about. And so just again, being mindful as we gather information that we are the ones that will do the work, and just to be mindful not to put it on others to come up with solutions. We're open for good ideas, and people should feel free to share, but we're the ones that need to do the work.
Thank you, Brian. Thanks for remembering the invisible labor. Yeah.
I do have a quick question myself.
Yeah.
This is Steve. With the the initial slides, I think it was slide 7 or so, when you're talking about the increased stress that everyone was experiencing, was there a differentiation? Like at our agency, I would say 90, probably 85 to 90% of us were working remotely, but 10 to 15% had to be in the office. Were all these people working remotely trying to do their work as well, or were they also some in the office, and the compounding aspects of the pandemic and making appointments for people to come in and that kind of thing?
Yeah, that's a really good question that we did not ask in the survey. Oh my gosh, there were so many questions that we wanted to ask, but it was a gigantic survey. It ended up being when we were just trying to do a temperature check, but then it got bigger. But it's a mix, Steve. I think probably OHA does have more staff being able to work from home or remotely than, for example, ODHS. But then we also have Oregon State Hospital, right? And so that is a workforce crisis happening. The governor had to call the National Guard in. They're like hiring international nurses to come and help. So we do have a few, we have Richard Mayak is our Oregon State Hospital liaison for the People of Color Employee Resource Group. He's in charge of Native Services at Salem campus and Junction City campus. And so, asking, and I'm sure that they didn't all participate, but maybe 2 or 3 did, and so that would be a in-person experience that's going on. Yeah. But then also our public health division folks, there's Vital Stats that's in the Portland State Office building. So maybe interaction there with the public, and other, I don't know, outreach, right? With COVID, that kind of thing.
Thanks.
Angela. Oh, sorry, Steve. Does that answer your question?
Yeah, that's good. Yeah, we absolutely.
Okay.
So first, thank you for presenting all that, Emily. That was really useful information. I just wanted to echo some of the kind of findings that you had in terms of what we're hearing at our agency. Yeah. Very similar things, especially related to access to mental health services, having to wait until it becomes a crisis or you have a trigger point and not able to access it for the more initial things that are going down the wrong path. Transportation issues, especially in rural areas. We don't tend to think about that for our staff and members, because we think, well, they got to work, they have transportation. We think of transportation in terms of more of that public service, lower income support, but family members of somebody that got to work may still have medical transport needs. Because that vehicle that they took with them to work instead of having it available at home, or it's someone who can't drive. And so it's always one of those that there's this assumption that everyone in the household must be able to handle access to medical care. And I like that you touched on that early, that difference in multi-generational households and how each one has a different experience in their healthcare access. And that's something we hear as well, especially in rural areas, but just in general. And then one area that I thought I'd highlight that you didn't directly touch on, but I've heard, and so just to share for the group, is that we've heard a lot of staff struggling with referrals staying up to date. They felt that pre-pandemic, their providers were better about making sure that like, okay, you have an active referral, you go for this all the time, I'll make sure to renew it. And that staff are instead having to like post-date their referrals after they get a bill, finding out that something that they thought was covered because there was an active referral wasn't anymore. So there's this additional
wow.
burden on the member to clean up or pay a bill and be educated enough to know that's what they have to do when they get a bill to be able to solve that problem. And we've heard that a couple of times from staff who thought they're like, isn't this my provider's responsibility? So I think maybe even that's a note, maybe Brian, is something we can touch on later as something to see if there's something actionable around that as a recommendation, because we've heard it multiple times recently.
Yeah, that's
And to
great.
that end, Angela, I would say we have invited our medical carriers to listen in on these meetings. So again, I'd say to Moda, Providence, and Kaiser, as you're listening in and taking notes, I almost guarantee you we will invite you back next month or the month after. And just think about some ideas you have on how to better connect with our members, ideas for getting some of this information to them. Things like, if you're a member who's looking for an African-American provider, how does that actually work? How does that happen? Are you going to be, if you call up and if you can't find what you're looking for online, are you putting in a queue with everyone else, or is there a better way to get what you need? Given that request. So, things like that, carriers just start thinking about. Well, certainly we and Mercer will be in touch.
Yeah. Is it all right if we have Rebecca introduce herself?
Absolutely.
And then Rebecca, feel free to chime in. I was sharing that you had a lot of diverse perspectives given your various roles.
Thanks, Emily, and thanks for doing such great job synthesizing everything that all the things we've heard and we've done and seen and talked about. I'm Rebecca Knight Alvarez. I work at OHA right now in Business Information Systems as a data quality coordinator. I'm also the other co-chair of the People of Color ERG. I've had multiple roles through the pandemic and helped in the COVID response in multiple positions in the COVID response. And I've also been in the Health Systems Division doing special projects around behavioral health. And I was listening to how you were reflecting and processing all the things that wonderful Emily has brought forward. I was curious on if any of those ideas or concepts or data that you heard today was shocking to you from your perspective, things that I heard about the things that you've also heard, but things that you haven't heard, because we hear most of these concepts regularly and are actively trying to align and think through ways to make the environment better for our colleagues and friends and ourselves. So I just wanted to see what you guys thought that you hadn't heard before. And then there's some things that I could dive deeper, for instance, around engage to change, where I really would love some more collective thought on making that more of a beneficial experience for staff of color and even leadership of color, trying to keep them not feeling emotionally exhausted and carrying a lot of invisible labor through the processes we're changing our culture to be less racist, anti-racist, and more proactive.
So for the committee, did anything surprise you? I don't want to speak for you, Teresa, but it feels like we've been talking with Emily and gathering so much information that I don't feel like I'm surprised by anything. I think, I expected to hear some comments and some pretty tough comments. And again, I think that's exactly what we need to hear, because, that's what members are going through. But what do you guys think, committee members? Did any of it jump out or stand out to you? Anything surprise you?
I will say something. No, Brian, really did not surprise me. I think that even worse cases out there that we haven't heard yet.
Yeah, that's.
I know that I have one, but I'll leave it for later.
And that's a good point, that we're just hearing stories that members are comfortable sharing.
Yeah.
So, I mean, I think we can all just acknowledge there's a whole layer of reality out there that we don't exactly know about, but that is happening.
And I would just say that Rebecca and I have heard really terrible stories that are not reflected in these survey results.
Mhm.
Even just one of our Oregon State Hospital employees, and he has given permission to share his story, but he is Black, African American, mental health support technician, was accompanying a patient to be discharged to Washington County authorities. And when they got in the room, the Washington County authorities mistaken him as the patient and tried to handcuff him. And so, like, that ended up being a very traumatic event for him. And it was an assumption that the Washington County officer made because he was a person of color, Black, African American. And so, but there's a lot of stories that aren't captured here in these survey results. But Rebecca and I, have heard some of those too.
And I will say, just based on what we've heard so far today, Emily and Rebecca, I think there are a number of areas that are actionable for PEB. I hear a lot about network and how networks are built and how members can access providers. So that's a continuous, I think, project and journey with our carriers. Is finding out more information maybe about how providers are recruited, maintained, how that information about providers are communicated, and making it easier, or at least educating members on how to find out or better quickly find the provider that's best suited for them individually. So I think there's a whole bunch of those like provider type access issues where there'll be a lot of things we can do, hopefully to improve experience, noting that it takes time for the carriers to build provider networks, and it's a big undertaking. And then also, I just, again, with the elder care, child care, just general anxiety and depression, I think there is a lot of room for us to work and continue partnering with Canopy, which we'll hear in a little bit, and figuring out, again, how we can better connect members to EAP services and how we can communicate that EAP is not just for folks who are feeling really overwhelmed or feeling like they're about to have a behavioral health crisis. EAP really is for everyone. There are parts of the EAP program, if you're a first-time home buyer, they have a program for you. They can help out with the elder and child care and help you kind of navigate that situation. So I heard a lot of situations where if we can just improve the way we connect members to EAP, that maybe we can get some meaningful improvements. And then also just the training and education, and that's something that I continuously want to open it up to members, carriers, and Canopy just to brainstorm with us. How do we do that better? Because I know there's a whole world of PEB communications out there with my colleagues, and we have our expertise. But in addition to that, I think we just have to ask the question, like how, if someone could benefit from EAP, what could we do differently to have them, directly reach out to EAP, and to know what EAP provides. So based on what I heard, I think there are a lot of things that PMAC and the Coordinating Council can do to make some improvements. I think there's both some short-term and probably some longer-term things. Also knowing that there's a whole health equity kind of body of work that goes on within PEB that we've made a part of our decision-making process. And so the expectation is going forward when we are about to propose something to our board that represents a new program or a program change, the expectation is that we would have vetted it through our health equity tool, worked with our health equity work group to make sure that they feel it is vetted enough to bring to our decision makers, In some of those instances, the board and or the health equity work group will want us to take the analysis to you guys, to PMAC and the coordinating council for review and feedback. So anyways, those are my initial just thoughts about, just what I heard. There are a lot of areas where I think PEP can, help and make some meaningful change in those areas, both on a short-term and a longer-term basis. Other thoughts? Were the committee members anything that surprised you or stood out, or any, just general impressions that struck you? Okay. So with that, Emily, is there any other information you want to share or in
Yeah, I don't know if Kimberly wanted to say something.
I wanted to thank you because I think just like Brian said, and I'm on the PEB board, and we need to hear the negative. I don't want any one of Department of Corrections staff not getting the care they need, and I don't want anyone to be treated differently because of their race or their choice or any reason. But we know it happens, and we can't act like it doesn't happen. So I appreciate, these meetings are recorded, these are public record, and I appreciate that we are calling it out and that we are saying that we will address and we will help and we hear our members, because that's the beginning. Listening and is the beginning, but then we need to act, which is that other piece that PEB and OEB and Innovation Work Group and all these groups are trying so hard with what we can do. So just thank you. So that's all I wanted to say.
You're welcome. Thank you for saying that. Yeah. I don't know, Rebecca, if you had any other comments, but I did have a little bit more to share, Brian, just some results from the 5 Oak Downtown Portland survey,
and we
which
still
is a
have
lot
time,
shorter.
so that's
Okay.
That's perfect.
And that's shorter. And then I was just going to end with the Roseburg, Douglas County story. Yeah.
Keep going,
Sounds-
Emily, keep going.
Keep
Yep,
going?
keep going.
Okay. Okay. All right, I'm gonna share my screen again. Feel free to interrupt me at any time because I won't be able to see you guys. Let's see, share my screen. Okay, so then, like I mentioned earlier, we also were conducting a worksite wellness survey. This is an SEIU worksite wellness survey in downtown Portland office, which is actually an office where there are 0 union stewards. And so they want to make sure that worksite, just want to get to know what that worksite is experiencing especially during this pandemic. Or we'll start with the pre-pandemic question. Have folks experienced any access challenges? And this group is more predominantly white, I would say. And the responses, there have been some problems navigating the system. This was a much smaller sample size. This is about 16 employees that participated in this survey. Also identifying culturally specific mental health provider who is trans friendly. So this is a theme. And then during the pandemic, what kind of access challenges have you experienced? So this person says, can't find an EAP therapist or counselor. No one was accepting new clients, so I went without. I've had no issues accessing my PEB benefits and healthcare during the pandemic, so that's good. This person says it remains a challenge to identify culturally specific mental health provider who is trans friendly. That's probably the same person that made the other comment. And then the Weight Watchers at Work, that ended during COVID, but our Weight Watchers leader invited us to join one of the virtual groups she was also doing. However, I am the only one from the 5 Oak building who attends her weekly Sunday meeting, which is in person now. So misses their coworkers. When they ask if Weight Watchers at Work will start up again, the leader wasn't sure. And let's see, new diagnosis. This person has a new diagnosis, so it's not related to the pandemic, but it's been very difficult to navigate care and prior authorizations for medication. Ideas that they had for addressing access challenges. This person talks about confusion over the vision benefit. Is there no card? How do I use it? Is it linked to my medical benefit? Another person talks about the issue around intense workloads being put on mid-management, which must be addressed in a more effective manner. This is having a trickle-down effect on programs and employees. Another person talks about, please encourage the health plans to recruit more culturally specific mental health providers who are also trans-friendly within the respective networks, so they aren't out of network. Another person says work with EAP to provide more robust offerings for group support at our worksite. For example, dealing with compounded grief, supports for multi-generational households when caring for both children and family and parents simultaneously, how to establish healthy boundaries with your manager, how to effectively address biases, microaggressions, racism, and racial trauma involving manager or colleagues, how to manage or triage high volume of email, how to document workload challenges to inform new strategies and approaches. This other person talks about insurance companies need to trust doctors in specialty areas rather than requiring lengthy prior authorizations that hold up the process. It's caused huge delays in getting the medications my doctor prescribed and that I need. And then I'm just going to end with this, Roseburg, Douglas County. This is an Oregon Department of Human Services employee story. And similar to what Brian started with, my understanding is this family it's a single mom, 3 kids. One of the kids is autistic also. And then I think the other 2 kids also have disabilities. They're different though. So the doctor she talks about that she saw stated that VSP, or the vision care company, they have no one to call with any kind of provider questions, and that they get half of the reimbursement rate that they ask for. And so as a result, I think this person believes that's why there's only 2 providers in Roseburg who accept the VSP. And then in her experience, the one of them wouldn't call her back, and she's thinking that it's probably because they're booked solid. They don't have any room to take any additional patients. And this person talks about 2 providers in the network isn't enough for their Roseburg population of over 100,000 in 2022. And then just makes the point that DHS alone serves about 300 people in the area. But there are many more employers and employees who also need access to vision care. And then this doctor shared with her that the other doctors refuse to work with VSP. And then this is the same family, and this is happening both pre and during the pandemic. But their son has disabilities that affect his ability to process quickly. And so having to change to a new provider who doesn't take the time to interact with a person with this type of disability successfully is really scary. It ended up being really scary for her son. And then it ended up taking extra time for everyone involved, including her, who was not there. But they had to sort of redo everything with the provider. The provider had to go over everything with her since her son did not understand her. Also talked about this doctor being really quick in her instructions and not checking for understanding. And, I think feeling stuck with limited options there. She was concerned that her son looked so visibly upset and confused when he walked out of this doctor's office. She says here, if I would have known that this provider was out of network, I would have stayed with my doctor of many years that my son is used to and does well with. He's been able to see his regular provider with no problems and on his own last year. So when I was trying to get some clarification about this story, this son is actually about college age now. And so they might be kind of in that transition of him starting to do things for himself. And then when I tried to clarify about the out of network, I asked her, I think, why didn't you just go to the regular provider? I think that regular provider actually didn't do the VSP thing. And so she called a new provider and then spoke to somebody on the phone. Do you take VSP? And that person said yes. And so she got excited and, kind of redirected her son over there. But then it turned out that person was new for the position and that was incorrect. And so they ended up getting an out of network bill later. So it's just an overall frustrating experience there in Roseburg and Douglas County. So that's it for the stories. And then I just added the slide about additional considerations, again, thinking about the interest in equity that this group has, the PMAC has and PEB has. So definitely encourage partnership with both the OHA and ODHS employee resource groups. I don't believe the other state agencies have employee resource groups yet, but I believe they're all interested in starting that. And these are just a few ways to potentially partner with ERGs. You can help co-sponsor Heritage Month events or other creative activities for employees and their families or communities. I had mentioned, I think at the last meeting, we just had the Black African American Heritage Month. Our OHA Black African American ERG Employee Resource Group did an amazing job, volunteer, member driven, with bringing in some really amazing speakers to help educate our state government workforce about the Black African American community in Oregon and national too. And then now we're in the process, our POC ERG is partnering with the Asian Pacific Islander Network ERG at ODHS. So it's an OHA ODHS partnership to plan the Asian American Pacific Islander Heritage Month speaker series. So we're going to try to bring in, I think, about 5 speakers for around mid-May, mid-June. It was such a success last year when we did this. We brought in 3 speakers that we're going to try it again this year. And some of the ideas actually we have are like a cook along, like bringing in, or maybe even bringing in a panel of chefs, but using that, like provide some healthy recipes, doing a cooking demo, highlighting some of our, culturally specific foods and health and healing practices, or maybe even having like a hybrid event where we could highlight our community-based organizations that have like the kitchen where the cooking can happen. I also just wanted to highlight this event that ODHS ERGs led on last year after George Floyd was murdered. Some of the Black African American colleagues there had talked about this feeling hunted after that. And so They actually facilitated this incredible dialogue of over 100, mostly ODHS staff, but then a lot of us ERG leaders at OHA were also invited to participate. And then there was breakout session opportunities so that people could have more intimate conversations with each other. I felt like that was a very emotionally supportive space that they provided. And then another OHA example, and I think I shared with some of you already, is that we did partner with EAP to identify culturally appropriate or specific group mental health provider or therapist. And so this was shortly after George Floyd had been murdered, and we brought in Andrea from EAP to do a session with our Black African American colleagues that we heard went really well. Unfortunately, since we have about $500 to $1,000 in our annual budget for ERGs at OHA, we only got one free session per year from EAP for a group session, and definitely could use multiple sessions. And then another additional consideration I brought up earlier at the beginning of the meeting is to really think about the Oregon's 9 federally recognized tribes, and that, that's a special government to government relationship that happens there, and the implications for us working with our tribal employees and their families and communities. And there are, like, a tribal affairs director at OHA, Julie Johnson, tribal affairs director, ODHS, Adam Vicente. There's also the, a legislative body, or anyway, there's a variety of resources to learn more about that. And then something that our POC ERG just watched together is this webinar that Race Forward, Vice President Julie Johnson was the presenter, that they just finished. They were brought in by Partners in Diversity in Oregon to do this webinar, and it was building racial equity for long-term sustainability. Our leadership at POC ERG really felt like this is kind of a must-see webinar for anyone interested in leading on anti-racism or racism or equity work. It provides key terms and shares like the definitions of those terms, and makes distinctions between, like, for example, anti-racism and racial justice, or equity, equality, diversity, and inclusion. Like, how are those words the same or different from each other? And it really talks about how racial equity work is really meant to be complementary, not competitive. It's not a zero-sum game, but a lot of folks come away thinking that it's a zero-sum game. So that's a really good resource for folks to watch and discuss afterwards. And then also, I've been attending this Government Alliance for Racial Equity conference today, yesterday, and 2 days ago. It happens to be in Portland at the convention center right now. And it was a good reminder of Dr. John Powell's concept of targeted universalism. So this is another approach, like a racial equity 2.0 approach, in terms of, making sure everybody's got access to the resources, the same resources, and kind of helping to inform, like, interventions to make correction when that's not the case for certain populations. whether they're rural and they have, you know, family members with disability and no transportation, or Black African American communities, you know, and having to deal with institutionalized racism, or not security not believing that they're employees, they're actual employees of state government, even though they've worked here for 30 years. I'm just, so I encourage people to check that out. And also President Biden's executive order 1395 that just got signed this year on day one of his presidency, advancing racial equity and support for underserved communities through federal government. So this is kind of a all of government approach, which has never happened in the US before. So this is happening, starting to happen now, and it's definitely going to have implications for state government and also county and city. Also wanted to highlight our friends Uplift Oregon here. We actually started to, our POC ERG started to engage in conversation with them about how we can get more support for the culturally appropriate mental health therapists, because our members really wanted that. So not just our Black African American members, but also our Asian American, Native Hawaiian, Pacific Islander members, especially with this surge of anti-Asian hate and violence. And then also our Latinx members, and Indigenous tribal members, and Middle Eastern North African members as well. And then there are just so many new and unprecedented partnership opportunities that we see this year, especially, I think, just coming out of the pandemic, and, you know, things, the inequities being just more visible than ever before. So that's it. That's all I have. I don't know if anyone has any final questions, and I'm going to stop sharing my screen.
Thank you, Emily. Very informative, a lot of good information. Angela?
Yeah, thanks. Seconded. I think, Emily, that was very informative. I appreciate all the info. I was just going to touch on something you talked about a couple times, especially with that example in the kind of Southern Oregon area of access to providers and trying to find ones that are, you know, culturally appropriate. And that's one of those things I've been hearing time and time again from, you know, peers, family, friends, even myself. But providers are leaving right now a lot from their practices changing, relocating, or even, you know, leaving the profession. And so people are actively looking for providers and finding a huge uphill battle and figuring out, you know, is there a provider not only available taking new patients, but the right one for me? So I'm wondering if that's something, kind of two thoughts. First, something we could tee up as a later discussion about what we can do to help, kind of maybe make recommendations about that for folks. And then the second is a question over to our presenters from Canopy about would that be something that could fall under that resource retrieval service program to help a member identify providers in an area accepting patients that do take their coverage and what their kind of cultural appropriateness is, and return those possibilities? And maybe we could look at a way to advertise that as an opportunity that folks can utilize that service for. So,
and Angela, I do think we will invite the medical carriers and Canopy back to present and answer some of that information. So I think that's the direction we're going in, unless anybody on the committee disagrees. It feels like that's a next good step. Okay, other thoughts or comments?
Yes, I do. I do.
Okay.
Veronica, I wanted to add to Emily, thank you, and I will look forward to working with you. Our agency has a diversity and inclusion council, and we've been on for the last 6 years. Our director is the chair for the council. Also, we do cultural sensitive to all the services that we provide to within the agency, within my office. And we have a YouTube where we add all the events, all the guest speakers from all the communities of color that come and present there, or the speakers that come and present there. So, you know, it may be another resource for you. And I would like to work with your group too. And Canopy is here. I want to thank them because last month, they came to our office and they did a workshop engagement with our staff and managers alone, recognizing the impact the pandemic, mental health have in our communities of color. And also for the managers is to understand that we all coming from a different background, and for them to be understanding of that. And they gave us a lot of tools. It was an amazing workshop. So, yeah, thanks.
Thank you.
So thanks again. So we do have Canopy, and they have about an hour on the, hey, Umberto, on the agenda. I'm going to skip the last agenda item, which is it's the next steps and meeting adjournment, because I think we've already identified some next steps along the way. So I would like to encourage folks to use the next, 3-4 minutes to stand up and stretch while Umberto and Shauna introduce themselves and get the presentation going.
It's a good idea.
We would consider taking a break, but honestly, based on the conversation we had earlier this month with the coordinating council, I think I just want to turn Canopy loose, let people stretch, and then again, open it up for questions as Canopy presents. And I'll be sure that we can wrap it up by 3:30 still. So without further delay, Umberto and Shauna, I will hand it over to you.
Okay, thank you, Brian. Yes, maybe we should all just take just a second to stretch. I don't know. That sounds good to me. Thank you, everyone. Thank you, Emily, for sharing all that, and Brian and Teresa for having us here. I'm here with one of my colleagues, Shauna Paladin. She will chime in later as we go through the presentation, especially if there are any clinical questions, as she does have a clinical background. We are on the account management team at Canopy, and I'm very happy that we are able to speak with you all. So I'm going to present. We don't usually work on teams, so hold on. Sorry, this over here. Okay. Oop. Do you see EAP utilization?
Yes.
Okay. Sorry. Still getting used to this team. We're on Zoom usually, so. But I'll go through this, and then it looks like I can expand you all later. So we will go over our services, just a quick recap. We'll go over some utilization data. We spoke with our clinicians and gathered some stories. We'll talk a little bit about outcomes, talk a little bit about promotion, and some ways that we can partner to get the word out about Canopy, because we know what people don't know about, they won't use. So with that, you all probably know, in general, Canopy services, they're all free and confidential for employees and their family members. Each agency picks the level of counseling visits. So it's either 3 or 5 sessions with a licensed clinician. And we are nationwide, so if someone has a family member in another state, another area, we do have counselors there that they can see. We are open 24/7. We are available for crisis counseling. The folks who answer the phone are mental health professionals, so they can provide in-the-moment consulting. If someone is in crisis, maybe suicidal, we can help them get to safety. So that's a always open kind of a service. We also have resources for life, so help with finding childcare, elder care. We can do resource retrievals. We can help with identity theft retrieval, so help with recovering ID. We have financial coaching. We have a home ownership program, which Brian mentioned. We also have a network of attorneys. So the first 30 minutes with the attorney is no charge. After that, it's a 25% discount off of the normal rate. And then there are other tools. We have life coaching. We have gym and pet insurance discounts. We have fertility health support. And then lots of digital resources on our member site. And we also have a proprietary DCBT or cognitive behavioral therapy app called Whole Life Directions that people can take an assessment and receive some help with online modules for various, issues that they're dealing with. So let me just go to the next item here. So I wanted to tell you a little bit about utilization for state of Oregon. So last year, utilization, and we are very conservative in what we count as utilization. It's just open cases. So those members that actually were served with service, they saw a provider. It's 8.1% of the state of Oregon employee population were served by Canopy. That's just a little bit above our book of business average, which is at 8%. And the national average, just if you're wondering, for kind of robust EAPs is closer to 5%. And then some lower service EAPs, it's down like 2%. So in looking at state of Oregon data, I'm going to show both top issues that the counselors helped employees with and members with, and then also some work-life issues. So pre-pandemic in 2019, it was number one issue was marriage or relationship issues. That's why people contacted us and wanted to see a counselor. Second was stress, then depression, then family issues, and then anxiety. Then 2020, with the pandemic, shortly after the pandemic started, we added COVID concerns, basically anxiety and concerns about COVID. So when we combine those two, in 2020, anxiety shot up to number one. And this is reflective actually in our whole book of business that just occurred everywhere. Then it was marriage and family stress and work. 2021, we did see some fluctuations, but marriage took back the top spot and COVID and anxiety went down, and we continued to see that in the first few months of 2022. Still high, still a lot of anxiety, but it's looking like it's trending down. Then on work-life requests, it basically has stayed the same pre and post pandemic. So number one, typically in our whole book and including state of Oregon, is legal. People want referrals to attorneys, and then help with housing. We have that home ownership program. And then one thing that's interesting is that kind of pre-pandemic and during the first part of the pandemic, it was financial, but then we did a lot more resource retrievals. Back in last year, basically, we did more like say around like the wildfires and whatnot. So maybe helping people with finding resources or programs and whatnot. And so just thought that was kind of interesting. Should I go back? Any questions? Yeah, on any, I know it's a lot of data, and then we're going to go to stories. Yes.
What was that? Resource retrieval.
Yes.
What's that exactly?
That is where a member calls us or contacts us and asks us to have a consultant help them find some sort of resource. So it could be they're new to an area and want some help with finding apartments, or it could be that their home was damaged in the wildfire and they're looking for emergency housing. All sorts of different resources that they might be looking for, where they would like someone else to do a bit of the legwork and then come back to them. So it's a pretty wide variety. Sean, I don't know if you want to. Help. You've actually done a lot. You helped back in the day with a lot of those.
Yeah, back in my early days. Yeah, it can even be things like psychiatrists on the insurance panel who are accepting new clients. Right, that can take a lot of time out of someone's day, so that's something we can easily provide that resource list for after calling around and seeing who has availability. Someone was mentioning earlier about the opportunity of having a resource retrieval on calling to find out providers in the area for, even if it's a medical clinician, we're happy to do that kind of research as well. So truly, it can be for a wide variety of specific resources that someone's looking for.
And that's where, PEB, and others could probably do a better job at just communicating that EAP is not just for folks who are in crises. That there are a whole host of services to try to help prevent members from reaching that point. And, again, I think a lot of the message from what we were hearing from our members is EAP provides a lot of services that deal with the issues that they're facing, and they either just may not realize it, or they just don't know where to get started.
Right. Like if we go back to this, there's a lot on here that we that we do, right? There is counseling and whatnot, but yeah, there's the financial resources, all these resources for life. So a lot that we do, and we'd love to partner with you all to do more to, get the word out about the different services. Any other questions, maybe around counseling or before I get into some stories? No? Okay. We'll have time for Q&A later on as well. So we talked to our clinicians, and we asked them for either some specific stories or just what they're hearing in general, if they maybe could bring it all together. So went ahead and wrote it out. I'll kind of read through this, but you'll have this available for yourself. But Lee's challenges were consistent with what other state of Oregon employees had expressed: anxiety and depression with tangible work-life balance struggles. Lee indicated that they had a hard time stopping or taking a break from their job when working from home. The line between work and personal life has been fuzzy and has been difficult at times to determine when they can step away for self-care and care for family and children present in the work environment. Lee spoke with a Canopy therapist and identified ways to have boundaries, take time for self-care, and collaborate with their manager regarding assignment expectations. Lee's worries decreased, mood improved, and the ability to focus on the job increased. Got a couple more here. Here's a direct quote. The names have been changed, so it's not the actual name. But Mo mentioned, "I love Canopy's benefits. I have accessed multiple resources, and every experience has improved my life somehow. I feel fortunate to have access to all the benefits, especially during the pandemic. Counseling, home buying experience, health and well-being management, and webinars have all had a positive impact. I will continue to access Canopy benefits as needed." And then just a couple more. So here's another kind of amalgamation. So Cruz was starting to feel burned out and low. Work stress, family responsibilities, and health issues were taking their toll on Cruz's well-being. Cruz knew from experience that talking to someone could help, and it was better to deal with things before they became crises. Cruz also knew that self-care was important in order to live up to all the commitments in life. And as a friend mentioned, there's a reason they tell you on a plane to put your face mask on first in case of emergency. So Cruz called Canopy. Cruz was given a referral to a life coach. The coach helped Cruz identify healthy habits and ways to get started. With encouragement from the coach, Cruz found that doing a few new things and a few things differently made a remarkable difference in feeling more energized and happier. Cruz indicated that they had a positive and empowering experience. They are on their way to practicing even better self-care and taking care of their family and job responsibilities. And then the last one is Pat. So Pat was suffering from anxiety and stress, dealing with the fear of catching COVID, relationship issues with their spouse, and money worries. Pat tried different techniques to deal with the worries that seemed to be growing, like trying not to think about different concerns, but the worries kept building. Pat was feeling at wit's end and called Canopy. The mental health professional who answered Pat's call provided an in-the-moment phone consultation where Pat identified that going for a walk had helped in dealing with stress and anxiety in the past, and it would be a good idea to try it again. Pat received a referral to a therapist, along with a referral to a money coach. After a few sessions of speaking with a therapist and a money coach, Pat found that making plans and taking different actions helped them feel better and more in control. Pat was thankful and indicated that their therapist helped them identify practical ways to deal with anxiety, and their money coach helped them to set a plan and start to get their finances in order. So that's all that is fairly typical of what our counselors and different providers have been hearing from state of Oregon employees. And it sounds like some of that is also reflected in what Emily shared, and Brian, I think you've probably shared some things also with the group about that. But any comments about any of these stories?
This is Cindy. I'm with the University of Oregon. I just want to share a story that we as an employer have used services through the EAP in dealing with like crisis counseling for entire units. So in the instances where we've had employees pass away, and it's been pretty traumatic for a whole group of employees, we've actually tapped into the EAP to provide consultation or counseling to the entire group as a whole, and have found the services really useful in those situations as well. So not only available to employees as individuals, but as, you know, supervisors or entire units within the workplace. So
Correct. Yeah, that's actually how I came to know of the EAP. I used to be in HR, and I've had employees pass away, or employees that I'm concerned about, or teams that were having issues, and we do have unlimited management consultations for managers at the state of Oregon, and then, like you mentioned, Cindy, the crisis support in case there's a traumatic event, and we're open 24/7. So, as you know, you can contact us anytime if there's a need. So, thank you for sharing that.
yeah, sure. And just another quick thing is that we've also reached out and had Canopy develop specific programs for us. So we've given them an idea of what we training or programs that we, or a webinar or something that we would like to design, and they've helped us design it and deliver that. So that's another great service the EAP provides.
Yeah, thank you for that plug as well. And we really enjoy doing that, by the way. So, doing that organization development, and we have a lot of training programs, but if we can customize it, then it speaks even better, right, to the population that we're talking to. So yeah, thank you for that. I should ask any other questions or anything else to add up before I go into just a little bit more. I'm going to show you some promotional items and go over a little bit about outcomes. No? Okay. So just want to share that once we provide a referral to a member, on average, it's taking about 5.5 days until their first appointment with a provider. Actually, for BIPOC, which we've been working really hard on adding more BIPOC providers, it's actually a little less. It's more like 4.5 days to appointment for a BIPOC provider. And the member satisfaction is really high. And we do actually a pre and a post assessment to look at workplace outcomes. And we are showing a 48% decrease in absenteeism, a 28% decrease in presenteeism, or turn it around actually and call it a 28% increase in focus, and a 22% increase in life satisfaction. Now, something that we know just in America is that stress is up, as Emily's survey showed, and that some of the common stressors are money, family responsibilities, work, and health issues. And that actually made us look at the different services that were accessed, and we thought we probably could do more around promoting our money coaches and the, as we kind of said, the resource retrievals. That would probably be helpful, and maybe also the life coaching around healthy habits and that sort of thing, because those numbers were not as high as you might expect with what we know is happening out in society. This is a little bit of an eye chart, but I just want to show you that we do have some promotional materials. One is for 3-visit plan, the other is for 5-visit. This is chock full of text, and we're actually trying to go more toward single line of coverage promotional materials that's more visual, less text, something that gets people's attention and then just quickly imparts some information and a call to action, to contact us. So, here's, like I mentioned, life coaching. We could, promote that, the resources for life, the app, the financial coaching. We do send out every month a newsletter along with a flyer around the topic that we're highlighting for that month. So these are some examples of those. Here's some posters that we have. Once again, trying to be a little more colorful, less wordy. And we have some occupation-specific posters, and we can customize these too. Our art department loves working on different flyers and posters and whatnot, but different ways to try to get the word out and appeal to people and have them notice, what we have. So with that, let me see if I can go back. That is really the end of that presentation. Okay, now I can see. Let me pull this over here. So are you still seeing? Yeah, you still are. Sorry. So now you don't see the presentation anymore, right?
No, we see your screen. There
Yeah.
you go. Now
Yeah, now you see me. Okay. I really haven't worked on Teams much, so thank you for bearing with me. So yeah, we'd love to discuss some different ideas. Teresa, Brian, Emily, and I, we've talked about some things like, outreach to ERGs, working with different groups, maybe promoting different services. What other ideas or questions or input do people have?
So I can share some of the stuff we thought about at the council meeting. So just as a reminder, PEB holds the master contract with Canopy. It's basically a price agreement, and state agencies are not required to accept the benefits. It's on the state agency option to purchase through EAP benefits through PEB. I think we have close to 100% participation rate for state agencies. It's really high up there. What state agencies purchase is, again, either that 3 or 5 visit model for their employees. And that means, I think it's based on each, is it a qualifying event, or I forget how you define it, Shauna and Umberto, but
yeah, each incident. Yeah.
So it's for each unique incident, you get, either the 3 or 5 visits before those run out. In addition to that, the price agreement includes so many hours that are divvied up among staff for stuff like critical incident stress debriefing and other types of trainings. We know that state agencies who do participate in PEB's program have also had the need for additional EAP services in the past because our contract doesn't cover everything. And I think based on these needs, we will work with Cascade or with Canopy. And I know old habits die hard.
Yeah.
And come back probably to the coordinating council and PMAC with some potential recommendations for program changes. So the Cascade contract runs on a July 1 to June 30 term, and state agency agreements are on that same term. So I think what we'll probably end up doing is identifying some potential recommendations to make that would be effective July 1, 2023, and then baked into both the contract and the specific individual agency agreements. And so one thing we could work with Cascade on is whether it's appropriate for the board to consider an additional service level. So we have heard that some other sectors will have 8 or even 10 visit models. And so just a kind of a fair warning, Umberto and Shauna, we'll probably want to ask you, hey, how many people are hitting up against the 5 limit and 3 limit? And based on the data, can we justify proposing an additional service level option of, let's say, 8 visits? In addition to that, as part of the renewal recommendations, we could also talk about what it would take to increase the number of critical incident stress debriefing hours, or add other general buckets for hours, knowing that, again, all that is baked into the overall costs. But when you're spreading it out over 100 plus agencies, it becomes a lot more cost efficient. So I think we could explore running some of those potential recommendations first through PMAC and potentially the council over the next few months, and then bringing it to the board this summer for their discussion. In addition, I also mentioned that there are a lot of state agencies who still have needs over and above what PEB provides in the price agreement. And one challenge, in my day job, I am PEB's contract team lead, and so I live contracts and procurement. And I can tell you, it's just not very feasible to be able to come up with a contract in short order, have it approved by all the necessary parties, sign it, and get the services you need. And so I think what PEB can do is explore with DOJ whether we can create some sort of DOJ approved template for EAP services that agencies could use. I mean, it would need to fit within their procurement authority and all that other legal stuff. But the concept would be is I would work with DOJ to come up with a pre-approved sales contract that met all the state terms and conditions and that Canopy could accept. So that way, when an agency does identify a supplemental need that's not covered by our contract, we kind of reduce the contract and procurement barriers as much as possible and still adhere to all the state requirements and all the legal requirements. So that was a big mouthful, but long story short, I anticipate coming back to both PMAC and the board with those sorts of thoughts and ideas, and I think probably over the next few months. So let me open up too, in terms of the committee, impressions about what you heard from Cascade and Emily. To me, there seems to be an obvious, not need, but area where if we could increase EAP utilization across some members, we could see a lot of benefit. And so just thoughts, impressions, and ideas.
I just have a quick question. I noticed on the Canopy resources, you talked about having phone service available for crisis counselors and mental health therapists are there. Do you offer that service as well through other means, by text or email, for somebody to reach out to a counselor, or is it only telephone?
Well, someone can request a referral to a counselor. But at this point, we're still talking to them eventually. So they can do an online request, in the middle of the night or something, but eventually we are going to connect with them. We are working on an updated member hub, a digital experience where people will be able to go through a guided pathway where they answer some questions and then are served up recommendations, which might include a counselor, right? And then they could also search for a counselor online. But we're not quite there yet. So, and then if someone is in crisis, it's really best if they contact us. They can text us, but we're going to ask them to connect with us. Shauna, yeah, thank you, Angela, for that. Shauna, anything you want to add about kind of the...
Yeah, no, I completely agree. For that immediate crisis support, we would definitely encourage phone. Texting and email definitely is not recommended for that crisis or immediate support, but absolutely someone could reach out to us anytime to try and get set up for services.
Any other thoughts, comments, ideas?
Brian, this is Teresa. Hi again, Umberto and Shauna. I think I mentioned this at the council meeting a couple weeks ago, but one of the most highly attended webinars I've offered is an overview of the EAP. And, I wonder, and I mentioned to Julie that this could be or should be an annual thing that PEB offers because we're getting new employees coming on board all the time. And so there's always going to be folks who could benefit from learning more about the EAP. And every time that's been offered, the comments are, gee, I had no idea the EAP did all of this. So, but my question is, do you think there's capacity at Canopy to do something like this specifically for an agency rather than opening it up to all PEB members? I don't know if anybody here on PMAC from an agency would think that that's a good idea. And if so, I'd love to hear from you. But I'm wondering if those kinds of webinars might be a little better received, or people might be more apt to attend if they knew that the presentation was just for people at their agency. So I'll just kind of put that out there both to
We
Canopy
do
and-
have the capacity, and we would love to speak with specific agencies. So yes.
Okay.
And even
So-
besides webinars, I just open it up for everyone on the call. Other ideas where members could be met. Like, I mean, anything outside of the box, inside of the box. I mean, just any other ideas for how Canopy could easier reach our membership.
Thanks, Teresa, for bringing up that piece about the webinars. I think that a big barrier at my current agency is that because it's often advertised via HR, and HR is not seen as a friendly partner at our agency, unfortunately. It's something that there's a lot of fear of engaging in that we hear from staff. So I'm thinking a different mouthpiece or advertiser of it than agency HR would have a lot of value. At this agency, I've heard similar from others that may be the case. So that may be one suggestion. And I know it's different. I've been at other agencies where that's not true. HR is really seen as a partner by staff, and they don't have that trepidation. And then,
Really good to know. Thank you.
yeah. And then another good thought is really just outreach to especially like seasonal staff, like trying to target as the season starts in natural resource agencies that hire for forestry and parks and other things, to target a webinar or outreach time period at that beginning of summer time when a lot of seasonals on board, because it's really when you'll get their attention and they're new and fresh and are available. So there's a huge wave of staff that only work for agencies during that summer time period or early fall time period.
Mm-hmm. Yeah, that's great. Yeah, whatever we can do to help with that. We also, one thing I'm thinking about is, for different agencies and whatnot, we do have a short little video. So like Tracy, you talked about like new people starting and whatnot. So like on onboarding or, in a staff meeting or whatever, they're showing this 70-second video. Just very quickly, goes over the services. Some agencies have also been handing out little wallet cards. We have Canopy wallet cards.
I was gonna say fridge magnets, just because
Yeah, we have fridge magnets too.
I've called the plumber a few times the past year, and it was due to the fridge magnet I had.
Yeah. So maybe a little something like that.
Yeah, this is Sydney again. We provide those little tear-off
Yeah, the tear-offs
to all of our departments, and especially supervisors that are in, like our housing custodian departments, and they may not have access to computers as much. We provide those, and we post that video on our website, and that in our new employee orientations and everything. So
there you go.
We try and get it out to as many people as we can.
Yeah.
And the other thing I thought about is just with some of the promotional material, having some that leads off with maybe downplaying it being EAP and just specifying the specific service, like, hey, are you a first-time home buyer? Because again, as I mentioned, I just think that's going to be one of the really big barriers to overcome, is just people's conception of what EAP can do for them. And that's been around since I've been at PEB, going on over a decade. So, that's something that I think we'll continue to work on. But if we could find a way to get a little uptick there, that'd be great.
Right. Yeah, that's part of why we have those particular like service line flyers, like pet insurance or life coaching or financial coaching or whatever, And it's not talking about counseling or anything crisis or anything, it's just here's a service. Call us.
How to get those in front of the members? How to
Yeah, Brian, I think that's a great point myself. I agree with that wholeheartedly, because again, just as we still know, the stigma of people's views of mental health and behavioral health is still very much alive amongst a lot of our folks. And so even if they want financial help or help with a house, they're seeing it through the lens of mental health resource. And so they may be reluctant, as opposed to realizing these are just services you can take advantage of that are being provided.
Right, you get a discount on your mortgage.
Yeah, exactly.
Would you guys be interested, among the various, I guess, proposals or recommendation you may want to consider, would one of them be highlighting reaching out to EAP as a health action under HEM, or potentially saying if you call in, it will count as 2 health actions or whatever the case may be. Is that something you guys want to consider among the options as well? Seeing a nod.
That's not a bad idea. That's good. I like it.
Yeah.
Okay. We'll do that. Okay. Other thoughts or questions for Umberta or Shauna?
Brian, there are some comments in the chat. I don't know if you've got a chance to look at them or if you would like me to read them.
Let's see. Oh, I see. There's one from Kaiser, I believe, if I can navigate. Oh, there's quite a few of them. So Emmy from Kaiser noted, have we considered creating an outline of barriers for what's preventing them to participate in EAP? We could consider doing focus groups at some targeted agencies to get their perspective. I think definitely focus groups, target groups would be great for folks who are willing to participate. And then what about stickers for your badge with information? Partner outreach with ERGs at OHA and DHS and state government new employee orientations, including Uplift Oregon. So yeah, quite a few. And I'm sorry, now my scroll, I just lost it.
Yes. And Emily, I will be contacting you.
One of them,
Awesome.
one suggestion on here was to be promoting the EAP as holistic services rather than mental health services, kind of just taking out that whole idea of mental health because of the stigma and just talking about, support services or holistic services. And then Angela says it would be great to be able to see data on EAP engagement in mental health and non-mental health services separately to see, as well as how engagement varies by agency. And I think, Shauna, you can, or both of you, Umberto and Shauna, can talk about the reports that are available to agencies.
And I think you'll be providing a report to PEB in May at the board meeting as well.
Yeah, I think we will. Shauna, you're like the report guru.
Right. Yeah. So the reports, you're absolutely welcome to request your own agency's report. I can pull previous years. I can pull year to date. All you need to do is just reach out to us. You can connect with me, or you can even reach out to info@canopywell.com. It'll all get directed to us, and then we'll send you that information. Absolutely. And it will have that breakdown on clinical versus non-clinical.
And Shauna, are you guys, as part of your presentation to the PEB board, are you going to be providing that? Typically, I think the way you break out agency utilization is you'll group some of the smaller agencies together. So will that be part of the presentation? And I just asked because we may want to encourage council and PMAC members to hold off on making the request until after the May board meeting, because that report may include a lot of the stuff they'd be interested in.
I also wanted to let folks know that in the guidance document for agencies who are asked to complete 2-year wellness plans is the recommendation that they get their agency specific data from the EAP. So your agency, whoever's drafting or responsible for implementing your 2-year wellness plan, has probably already requested that from EAP. So
yeah, we have been getting various requests from different agencies.
Yes, because agencies are drafting their 2-year wellness plans.
Okay, that's why. Okay, yeah.
Other thoughts or questions for Canopy? Okay, so it feels like, as I mentioned earlier, Mercer did contact our medical carriers who are attending and ask them to think about, a few different questions related to these discussions. So I think Teresa and I probably just need some time to reconnect with Mercer, the medical carriers, and then follow up with Shauna and Umberto as well over the next couple of weeks, and to line up what the next couple of months will look like for both PMAC and the Coordinating Council. I do think I could envision us coming back in May at PMAC and being ready to ready to talk over some of the potential EAP recommendations that would kind of come into play next year. So that is one thing for Canopy to think about is, that the supporting data that could support different service levels or other program modifications. So I think that is one of the things that we could also look at in May, in addition to inviting the medical carriers back to have a discussion about ideas they may have or other information that's relevant to this ongoing discussion. So I think Teresa and I have our work cut out for us, but I also think we're armed with a lot more valuable information than we were 6 months ago. And so I don't anticipate this will be a problem. I think for Teresa and I, the biggest challenge is figuring out the logistics, how we coordinate between the two committees, who needs to make decisions, in what order do we bring these things to, how do we vet them? But again, that's why Teresa and I are paid the huge bucks. So we'll find a way to earn our money and go from there. So with that said, any final thoughts for the good of the order from PMAC, the council, or any of the meeting attendees? I'm not hearing any. So thanks again to our presenters, both Canopy and Emily and Rebecca. Great information. I have certainly learned a lot over the past month. And we look forward to resuming again in May with probably a handful of action items. In the meantime, everyone, take care of yourselves, be well, and do whatever you need to do to relax and be healthy.
Thank you.
Yeah, everyone take care. Thanks so much.
Take care, everyone.
A lot of great information today. Thank you.
Thank you.
Thank you all. Good
Take care.
information. Thanks.